Again, my name is Jody Buchanan, Women's Health Nurse Practitioner and Menopause Society Certified Professional. Right now, I'm working at Sakura Health and Wellness in Andover. I'm also at the Sedgwick County Health Department as well. So a little bit of background about me. I was a nurse for a very long time, like 25 years. And in the middle of COVID, I was working on labor and delivery and had been for a while. And I decided that the longer I was in labor and delivery, the more my passion for women's health kept building. And so I think it's funny, in the middle of COVID, I decided to go back to get my master's and become a nurse practitioner. So that's what I did. And as I've learned more through school, the more passionate I have become about women's health. I feel, like I said before, there's a huge gap in knowledge and education for women's health. And I'm trying to bridge that gap a little bit with these classes, just to help other women, teenagers out there that are wondering what's going on with their bodies. Because I don't know about you, but I had a lot of questions that I never knew the answers to growing up, even into adulthood, because some things just weren't talked about. So that's what I'm here for. So with that being said, we'll move on. So starting with, why do we have periods? So lucky women, we are the bearers of children, and that is basically why we have a period. This picture, I'm sure most everyone has seen some form of it before. It's just showing the ovaries, the fallopian tubes, the uterus, where a potential baby would grow, and then the vagina. At the end of the vagina, it's not shown on here, but there is a cervix. That's what the baby passes through. So in a menstrual cycle, it is triggered by several things. Mainly it's brain signals. The brain signals the ovaries and other factors, but it basically triggers the ovaries to mature and produce an egg. There's multiple hormones that are involved with that, also the uterine tissue. So it's a very intricate coordination between the brain, the ovaries, the uterus, the eggs, all of that to, in effect, have a normal period. The uterus is made of muscle tissue. So when you're pregnant, when you're having a baby, when you're having a period and you are having cramps, those cramps are the uterine muscle squeezing. It's pushing the leftover uterine endometrial lining out in the form of your period. So this balance of brain signals, hormones, the organs, the uterus, all of that working together, it takes time for it to work together smoothly, for things to happen on a regular basis without any issues. It's kind of like starting up your computer for the first time. You kind of have to give it a little bit to get warmed up before it knows exactly where you're going to go, what icons you need, what apps you need, that type of thing. It's kind of the same thing. When you finally reach the point where you're having regular monthly periods, and there is variation, but when you're having a period every month or every 4 to 5 weeks, then what that tells us in the medical community is you're fertile. So just something to keep in the back of your head. More about a normal period. So when we talk about normal, I would also say typical. Most generally, they start between the ages of 12 and 16. As time goes on, we have seen that periods can get earlier and earlier. I have heard of them being as early as 8 and 9. So just be aware that it can be earlier, but in general, around 12 to 16 is the average age. However, those periods are not fully established until 18 to 20, because again, it takes time for those brain signals to become regular and functional, to be able to stimulate the ovaries, and the ovaries have to stimulate other things, and for the whole process to work correctly and regularly, it can take a while. Cycle length, again, there can be variation, like I mentioned before. What we consider normal or typical is anywhere between 23 and 35 days. As I mentioned before, in the first years, so say you start your period at 13, it's very, very common for periods to be irregular from that age until 18 to 20. You shouldn't have any worries, but you should bring it up to your doctor just so they're aware, so that if they think, you might need some testing ran, they will have that in the back of their mind to know. The bleeding amount can fluctuate. It can be anywhere between light spotting to fairly heavy. We'll talk about heavier periods later, but just know that bleeding can fluctuate. Blood clots can also be normal and common, but they should be smaller than a quarter. If you're having clotting that's larger than a quarter, that's too large. Typical amounts of days of bleeding is anywhere between 3 and 7. Now, if you're at 8 days of bleeding, again, I would probably bring that up with your doctor, with your nurse practitioner, but that might just be your normal. Because again, everybody can be a little bit different. We have to look at the whole picture of what's going on. Because that last point there, periods are controlled by many factors. When you have abnormalities, especially after you're over the age of 18 or 20, when you have abnormalities, a lot of times those abnormalities are caused by hormone problems. Why? Because remember, it's those brain signals that are going to the ovaries. Those ovaries are sending out signals and producing hormones. And if something's off, a lot of times, not always, but a lot of times it can be due to those hormones that aren't quite in the right levels and balance. So what exactly is happening when you have a period? So what happens, there's again lots of hormones that are working together, but the main thing that's happening is the beginning of your cycle. So when you have your 3 to 7 days of bleeding, that's considered the first day of your period. After those first 7 days, actually, as you're having the bleeding, your hormones are changing. Your estrogen levels are rising. That estrogen level continues to rise until midway through your cycle, and that's when you ovulate. That's when that fully mature egg is released. After the egg is released, there's some more hormone changes, and then if no pregnancy occurs, that lining sheds, and that signals the end of your monthly cycle and the start of the next monthly cycle. So the first day of bleeding, when you go to your physician, your nurse practitioner, and they say, when was the first day of your last period? That's why they do that, because that is the beginning day of your cycle. So, as most of all of us know, we can start to have symptoms of our period a few days before. Common symptoms that we probably are all familiar with are going to be cramping. You might feel fatigued. You may notice that you have more diarrhea or feel like you need to have more bowel movements. And in general, you just kind of feel yucky. And those are very common symptoms. Ibuprofen can be used 2 to 3 days before your period to help kind of stave some of that off. It doesn't completely eliminate those symptoms, but it definitely can help. Ibuprofen is superior to Tylenol because of the chemical reactions that are happening when your period is beginning and you're getting close to that day of your first day of bleeding. The heaviest days of bleeding are usually kind of in the middle of your period, around day 2, maybe to day 4. A typical period starts out fairly light, and then within a day or two, it gets heavier. It may be heavier for a couple days, and then it starts to taper off again, to where when you're ending your period, it might be more of just spotting. There's lots of variability between individuals. Some women only have light spotting during their period. Some women have fairly heavy bleeding. Some women don't have any symptoms at all, and then there's others who really struggle. So lots of variation. Important point. If you know someone or yourself and you have not started your period by the age of 16, please contact a provider, because that is a warning sign that says, hey, something is wrong, and that needs to be evaluated to make sure that is taken care of and treated. So this will be the beginning of when things go wrong. We kind of mentioned a little bit about PMS back on that first or second slide. PMS, as most of you probably know, is premenstrual syndrome. It's that syndrome that we notice a couple days before our period starts. It can include symptoms like I was talking earlier: fatigue, diarrhea, cramps. Maybe you feel bloated, headache, your back hurts, you're just feeling pretty miserable. Some women will also have flares of acne with this as well. So with that, it's just the change in hormones. So it's typical and very normal to have PMS. We usually treat with ibuprofen, like I had mentioned earlier, a heating pad, sometimes light exercise like walking. It may not seem intuitive because you're feeling yucky and you may want to go curl up in a ball, but sometimes exercise can help. The reason why is when we exercise, our body makes endorphins, which are our natural painkillers. So if you can muster up the umph, if you're feeling really miserable, to go for a short walk, maybe do a little bit of yoga and stretching. Sometimes that will kick in those endorphins that will help with those cramps and that yucky, uncomfortable feeling that you might be having. The other thing that a lot of times will help is just time. As your hormones are adjusting and you're feeling miserable, eventually, most generally, those symptoms will subside or at least taper down because your hormones start to regulate a little bit better. So the other syndrome that I have listed up there is called PMDD. You may or may not be familiar with that. What that is premenstrual dysphoric disorder. What that is, it's a big word, which basically means it's a severe form of PMS. So with PMDD, you have all of the same symptoms, or you can have all of the same symptoms of PMS, but you also have anxiety, depression, irritability, you may have mood swings, you may have intense food cravings. So it's like PMS, but on another level. So folks that have that really, really struggle with periods and going through their menstrual cycle. There are treatments out there for PMDD. It's best to talk to your provider or come see me and we'll talk about it, because it depends on when those symptoms hit you, what symptoms you're having, and how long those symptoms are occurring, that we can look at those and come up with a plan to treat them. There's lots of different options. I know there's hormonal birth control on here, and a lot of people, they don't understand. They're like, well, why do we always have to treat with birth control? The reason why is because birth control helps regulate your hormones. So back to that first slide, if your periods are abnormal or they're causing you a lot of issues, interfering with your life, we can use hormonal birth control to help control your hormone levels so you don't experience those intense symptoms, if that makes sense. Next one is the missed periods and irregularity. I kind of touched on that at the beginning, because remember, it takes several years sometimes before those connections between your brain, your uterus, your ovaries, and all of those hormones that have to work together, before those are fully established and working properly. So again, it's not incredibly abnormal for a young teenager to have irregular periods, but I always tell patients, keep that in the back of your head. And when you go to the doctor, let them know. And then as you age, if those do not go away, then your doctor can be more on top of checking into what's going on or what's possibly going wrong. Symptoms would be anything outside that normal range that I talked about. So if you're having a period beyond every 35 days, so maybe you have a period, say, once every 6 weeks, or maybe longer. Some women will go for 3 months and not have a period at all. They don't have any cramping, they don't have any symptoms, but they're just not having a period at all. Or maybe you are having heavier bleeding. Instead of it lasting 7 days, maybe it's lasting 2 weeks. Those would be things to let your physician, your provider know about, because those would be considered irregularities. The treatments for those, again, it's going to depend on the individual. You'll need to have a consultation, go through all the symptoms, the timing, what your bleeding looks like, how long between periods, lots of questions to figure out exactly where the problem is and how to pinpoint it. And then we can figure, then we can figure out treatments. Sometimes that would include blood work. Sometimes that's going to include medications. If we find out that your thyroid is not working properly, maybe it's hypoactive, it's underactive, which would be a cause of irregular periods. Sometimes all we need to do is get thyroid medicine on board and your period magically comes back and is working as it should. Or anemia. If you're low on iron, sometimes your body's just not going to bleed because your body's holding on to all that hemoglobin that it needs to function. So well-balanced diet is also important, and definitely stress management. We'll talk a little bit more about periods and when things go wrong as we're going on, but just know that lots of things can throw off your period. Stressful events. When you have stressful events like maybe you move, you go to a new school, you move to a new house, maybe if you're a parent, maybe you have a child, all those stressful events can throw things off. The other thing that can throw it off is dieting. If you lose a significant amount of weight, it's usually more when you lose it very quickly. That's a very stressful event on your body. And so that can throw off that timing of your brain. Moving on. Polycystic ovarian syndrome, PCOS, and endometriosis, you may or may not have heard of. They have been around for a while, but I feel like there's not a lot of information about it. And sometimes the information that is out there is not the most accurate, so it leads to a lot of confusion. So polycystic ovarian syndrome, it means exactly what it sounds. Polycystic, it means multiple cysts. And that means that, in effect, as we talked about earlier, your brain is sending signals to your ovaries to produce that mature egg. And then once it's produced, then your cycle moves on to where you can be pregnant, and if not, then that lining sheds. With PCOS, the brain is sending signals to the ovaries to produce that egg, but for some reason, your brain and your ovaries aren't working together the right way, and so you never quite make enough estrogen, you don't have enough hormone to mature that egg fully and ovulate. So what we see is ovaries that have multiple cysts in them. So your body's continually trying to push out a mature egg, but it just doesn't have the oomph to do it. So with that, the symptoms that you may see, which are very common, are irregular periods. Some women will even have facial hair. Along with that, there's what's called a metabolic syndrome, and that basically what that means is your metabolism is thrown off as well. Remember, most often, not always, but most often, when periods are not working the way they should, there's some hormone off somewhere, or there's multiple hormones off. And because of that, it affects your metabolism. So a lot of times we'll see women that are overweight, maybe they're obese. Another sign that we see are skin spots. You may see darkening of the skin around the skin folds. So around the neck, maybe under the armpits, in the creases of your thigh, sometimes on the inside of your thighs, and even on the abdomen, like where you have a crease around your belly button. Sometimes you'll have skin darkening there. And all those point to hormonal issues, and it may be leading you to PCOS. So women that have PCOS, a lot of times they'll have these symptoms. They can also have no bleeding or spotting. Sometimes they're on the opposite end where they also have heavy bleeding too. So lots of different things that factor into PCOS. There are treatments. Unfortunately, we don't have a cure because, again, most generally it's hormone problems. There's some imbalance in your hormones. We can try to get those hormones balanced, but we can't necessarily cure it. Treatments. First line for this is hormonal birth control. It goes back to the same thing. Those hormones are out of balance. We're trying to control the hormones. Weight loss can help for many reasons. I don't want to go into all of that tonight, but weight loss can help just because it helps with the metabolic problems. Hair removal, obviously, and metformin. Metformin is a drug that's used for diabetes. I'm not saying that people with PCOS have diabetes, but it helps lower blood sugar. And sometimes with PCOS, since it does involve metabolism, it throws off the blood sugar in the blood. So we can use metformin sometimes to help with that. Endometriosis is another one. Endometriosis, what it is. So when we talked about periods at the beginning, when that endometrial lining, let me go back. When the endometrial lining, this darker pink color that's right here, during your menstrual cycle, that lining gets very thick towards the end of your period. It does that in anticipation of a possible embryo. And as it's doing that, let me go back to where I was at. As it's doing that, it's again preparing for an embryo. So if an embryo comes down and implants, you have a pregnancy. If not, that lining sheds, and that's in the form of your period. With endometriosis, we don't know why, but for some reason that endometrial lining that I was pointing to just a minute ago, it is found in other places than the uterus. It can be in the abdomen, it can be on the bladder, it can be on the stomach, it can be anywhere in the body. And when you have, and let me back up, and when you have that, it acts the exact same way that it does in the uterus. So when you have your period and the lining is shedding in your uterus, those what we call endometriomas that may be on your bladder or your bowel or on your stomach, wherever they're located, they also start to bleed. When you have blood in places that it's not supposed to be, it's very painful. So symptoms of this, unfortunately, it's very, very uncomfortable and painful for women. Pelvic pain, back pain. They can have painful intercourse. Most generally, they have very heavy periods, a lot of clotting that occurs with their period. So there are treatments available. Unfortunately, there is no cure, but again, we try to treat it as best we can. Hormonal birth control is top of the list again for the same reasons. We're trying to balance those hormones, and we're trying to stop women that have endometriosis. We're trying to stop them from having a period. If we can stop the period, we can stop the bleeding, which would then stop the pain and the back pain, the pelvic pain, the pain with sex, all of that. So if those endometriomas, those areas of endometrial tissue that are on the organs outside of the uterus where they're not supposed to be, that will help. The other thing that we can use is surgery. That's usually a last resort, and it doesn't always last for long, but it can help, for a short time. The other thing that I want to touch on for things that can go wrong, fibroids, bleeding disorders, and ovarian cysts. So fibroids, if you're not familiar with them, they are benign, non-cancerous growths that happen all around the uterus. They can be inside the uterus, outside the uterus, in the wall of the uterus, if that makes sense. And when those are there, they're very similar to the symptoms of endometriosis. You can have heavy flow, you can have pelvic pain, you may have clotting with your period. Those are very common with fibroids. There are treatments out there, but again, you need to talk to your provider because they're going to have to rule out other things and make sure that that's what's going on. Bleeding disorders. If you have factor V, if you're familiar with that, where you have difficulties with clotting in your blood, a normal period may be very severe for you because you're not having the clotting factors available. And so instead of bleeding what's considered a normal amount, you may be bleeding heavily. So when we talk about what goes wrong, we have to look at the whole picture to figure out exactly what it is. We can't just look at symptoms and go, oh, it's this. It would be nice if we could, but we've got to look at the whole picture to make sure we're not missing anything. Ovarian cysts, just like what it sounds, it's a cyst on the ovary. We make an ovarian cyst every month when we're menstruating and having a cycle. Remember, those brain signals tell your ovary, hey, get that egg ready to ovulate. So every month we're making an ovarian cyst. The problem is that normally that ovarian cyst, that follicle becomes the egg and then it's released and it is, it comes out of the ovary. With ovarian cysts, for whatever reason, they grow, but they're not released. And so a lot of times those cysts are stuck in the ovary and they continue to grow and grow and grow. Your ovaries are fairly small. I forget the exact measurements, but they're fairly small. So if you have something inside of it that is growing, obviously that's going to cause pain. So most generally ovarian cysts will resolve on their own, but it is a very good idea if you're having pelvic pain, if you're having heavy bleeding, if you're having anything out of the normal, go see your provider so they can evaluate you. For fibroids and ovarian cysts, even bleeding disorders, you're going to have blood work checked. You're probably going to have an ultrasound so they can actually look inside and see if they can see the ovarian cysts, see if they can see the fibroids, which they should be able to. If bleeding disorders are found, referrals are often given because you're going to need to see somebody more specialized. And especially with fibroids and sometimes with ovarian cysts, it does require surgery to remove those, to get rid of those symptoms. So hopefully I didn't confuse everyone too much with all of that. I know I give a lot of information, but I want to educate as best I can. So period trackers, we're going to kind of change gears. Period trackers are wonderful. So obviously they're going to help track your period, but what they will help you and your provider do is track your symptoms. So if you or someone you know are suffering with issues with their period, have them use a period tracker for 3 to 4 months while they're waiting to get in to see their provider. Or if you come in to see me, have them use that, have them track their symptoms. Have them be able to look back and say, okay, this month my period was 30 days, and maybe the next month it was 38 days, and maybe the third month my period was, I don't know, say 40 days. And you can put your symptoms down too. Maybe you noticed heavy bleeding on this month, those types of things. That way it helps the providers again, look at your overall picture of what's going on, because it helps them to be able to figure out what hormone may possibly be out of whack and what hormone is causing your symptoms. So period trackers are fabulous to use to help not only you, but your provider. So again, this is kind of a reiteration of what we talked about. Track your cycles, your symptoms, your life changes. So if you've lost 20 pounds a couple months ago and now your period's out of whack, we need to know that. That's very important information. So anything that you can tie to your symptoms, write it down, bring it in. We'll use it in your consultation. Because in the end, that's going to help us, again, see that whole big picture of what's going on in your body. Because when things are out of whack, your body's trying to tell you something, and we've got to figure out what it is. All right, so Do these symptoms sound familiar? Do you know somebody with these symptoms? Don't fret. We can come up with a plan together. Again, I work at Sakura in Andover. I'm there all day on Thursday and then every other weekend on Saturday from 9 to 12. I'm hoping to be there more often, but I'm still building up patients. So as I build up patients, I'm going to be there more often. So at Sakura, we're a little bit different, which I absolutely love. We are not your typical doctor's office or family practice. All of our appointments are an hour long. You have 60 minutes to come in. So we get to know you. Hopefully you get to know us. We talk about all your symptoms, all of your concerns, and we work together to come up with a plan that best suits you. I'm not going to have you come in, you tell me your symptoms, and I'm going to say, okay, this is what we're going to do. I'm not going to do that. I don't want that when I go to my doctor, so I'm not going to do that to you. We're going to work together and figure out what works best for you. So if you tell me, I don't want to use birth control, that's okay. We'll figure out plan B. We'll talk about all the options, the risks, the benefits, the side effects, what we need to be watching for, all of those things. We're going to work together, figure out a plan that works good for you, that will help with your symptoms. So the first question that I have here, how do I know if my symptoms are something to see a healthcare provider about? This is a very good question. I know sometimes I'm a nurse by trade, and so nurses are typically very stubborn, not all, but we can be. And so we don't like to go to the doctor. So sometimes it's hard to know, well, should I go? Should I not go? Is it really something I need to be seen for? This is what I tell patients. If you're having symptoms that are interfering with your daily life, it's causing you to miss school, it's causing you to miss work, it's causing you to maybe not be the mom that you want to be, to not be the wife you want to be. Absolutely, that is a red flag that says you need to come in. You need to come in to see me, your provider, somebody else. Please be seen. There are treatments available out there, and I would hate to see anybody out there suffering needlessly when there are treatments out there for most of these conditions. Again, a lot of them don't have a cure, but there are definitely treatments that will help with symptoms to hopefully get some of your life back so you feel more like yourself. What can I do for really painful cramps? We talked a little bit about that at the beginning, the heating pad, the ibuprofen. Remember, you can take that before your period starts. If you know that your period comes around, I don't know, say the 15th of each month, and you know that the first couple days you are just miserable, it is absolutely okay to take ibuprofen. Say the 15th comes on a Wednesday, start taking ibuprofen maybe on Sunday. Now, you don't need to take large quantities of ibuprofen, but maybe take a couple ibuprofen every 8 hours, just to have a little bit on board. That small amount of ibuprofen is going to help curb those symptoms. And you don't need to take it your entire period. You might take it, a couple days before your period, and then maybe up to day 2 or 3 when things kind of start to settle down a little bit. So ibuprofen is good, heating pad is good. That light exercise, rest, stretching, stress reduction, maybe do some journaling, things to kind of calm your mind. Sleep is always good. When you are tired, think about it. When we're tired, we're all grouchy. Things hurt more. Our body hurts more because we are tired. Being fatigued and tired affects our whole body. So sometimes just taking a nap is a good thing to do, good thing to help. Next question I've got. What are some common reasons for period irregularities in young teenagers and young women? Another good question. It can be something as simple as that brain organ hormone connection is just not there yet. So again, that usually just takes time to correct. It just takes your body a little bit to figure it out. But that's a very common reason for irregularities. Another common problem can be thyroid issues. I mentioned that, I believe, at the beginning. When your thyroid isn't working correctly, say it's underactive, your thyroid controls all of the processes, metabolic processes in your body. And so when it is underactive, it in effect slows everything of the body down. It slows your metabolism, it lowers your body temperature, it decreases the rate that you ovulate and have your period. Lots of different things. So thyroid issues could be at the heart of it as well. So that's where that blood work comes in. Let me find where I'm at here. Oh, the other thing I wanted to say with that too, irregularities, which I think I mentioned earlier too. Too much stress. Maybe you're not eating enough. Maybe you're not getting enough sleep. Maybe you've had a loved one pass away. Maybe you've lost your job. A super stressful, high intense few months can definitely throw things off. Absolutely. The other thing that may be contributing to that is eating disorders. If you're not eating enough, if you have anorexia, if you have bulimia, that's a stress on your body. I know that people use that to try to control their weight, but it is a very stressful event for your body to go through that. So it could be something even something like that is throwing your period off. And then the last question I have here, what lifestyle or diet tips would you recommend for helping manage periods? So this is also a good question. Some common lifestyle tips that might help. Using magnesium. There's lots of different magnesium formulations over the counter. I do like to use magnesium bisglycinate. It's a big word. It's a form of magnesium that helps with relaxation. It helps with muscle cramps. So those of you like myself, when you go to sleep and your legs start to cramp up at night, magnesium is typically recommended for that. It can also help for period cramps. Remember, your uterus is a muscle. So if you give it magnesium, sometimes it helps calm it down so it's not cramping quite so much. Hydration is very important. It's no different when we exercise and we sweat a lot, and then maybe the next day or that evening our muscles are really hurting because we didn't drink enough water that day. It's the same concept because, again, our uterus is a muscle, so make sure you're hydrated. When you're on your period, you're losing fluids. So it's important to stay hydrated to help prevent against that painful cramping from the muscles. Decreasing sugar and refined carbs. The reason for that is when we eat a lot of sugar and refined carbs, it throws our blood sugar out of whack. And if any of you know someone who is diabetic, when their sugar goes too high or too low, they usually feel really lousy because it affects your whole body. Same thing for those of us that are not diabetic. When we eat a lot of processed foods, refined sugars, candy, all those types of things, it can have a similar effect on us. Our body typically will lower the blood sugar back down to normal, unlike a diabetic, but we can still have some of those symptoms where we just don't feel very good. So limiting those will help. What else? As far as diet, magnesium-rich foods, I talked about supplements. You can also get that through food. So dark green leafy vegetables, great for magnesium. Bananas are great for magnesium. The other one is my favorite, dark chocolate. That's my excuse to eat chocolate, is if I'm having a particularly bad day where my legs are bothering me, or back when I was menstruating and I had a lot of period cramps, I might have a little bit of dark chocolate because sometimes that can help as well because it adds in that magnesium. Let me see what else, if there's anything else. I'm going to check the chat one more time, or the Q&A here, and see if there are any more questions. It does not look like it. So I will end the discussion here for tonight. If you have other questions that you think of later, please shoot me an email, call me at the office. You can find me on my YouTube channel. Please reach out. I would love to work with you, family, friends, whoever you're thinking of that might need help. I would love to partner with them and work with them together to figure out how I can help them. If you need more education, more instruction, more help with anything, please reach out, because again, that's what I'm here for. That's one of my goals since becoming a nurse practitioner, is to help bridge that gap of the knowledge gap that's there. Because when women have education is power. Women are smart. We know our bodies. We can make good decisions for ourselves. So I want to be that kind of the go-between to help, again, bridge that gap and help women on their way, because we're completely capable of doing that. Sometimes we just need that little extra boost to get us going in the right direction. So thank you all for joining me. That's the end of my presentation.